So just to say welcome everyone, and as you probably just saw, this video is also being recorded for those people who may not be able to make it. Many of you know, my name is Inka Weisbecker. I'm at WHO. I'm a technical officer, and I'm leading the MSP project from the WHO side. And we also have here Quiva as well, who I think you see in the speaker view, who's leading the project from the UNICEF side. You might also see Vanya there, who's also on the UNICEF side as well for the project. And we have actually many more people involved that I will get to as well. But today you'll be hearing from Quiva and myself, and we'll be taking you through the MSP and what it is, what it includes, how to use it, and we will also have time towards the end for questions. So we really want to hear from you as well. Next slide. Yes. So here you see, as many of you already know, the MSP has really developed over time. Initially, the MSP project was funded by the Ministry of Foreign Affairs, Netherlands. It started about 2.5 years ago, and it was actually focused on health and child protection components of MHPSS. And then in addition, UNICEF has mobilized funding also from the UK government, and Education Cannot Wait, to also include education aspects on the MSP. And lastly, UNHCR has mobilized funding from the Global Protection Cluster to also include general protection and GBV aspects as well. So just to say that this MHPSS MSP, or Mental Health and Psychosocial Support Minimum Service Package, which is quite the mouthful, has really evolved over time to become something that's really intersectoral and involves many different people and many partners, which is something that's really exciting and we hope leads to better intersectoral work. Next slide, please. So who is involved? At the global level, you already know it's being led by WHO and UNICEF, but we are also collaborating as well with UNHCR and UNFPA, who are partners on this project. So we are the MHPSS MSP global team from the WHO side. Mark van Ommeren and Fahmi Hanna are also involved. From the our side, we have Peter Ventevogel, and we also have Alison Thomas as a consultant who's on the call as well. From the UNICEF side, we have Quiva, Vanya, who I already mentioned, also Anne Wilhoit and Zeynep Hijazi. And then lastly, from the UNFPA side, we have Henia Dakak. So it's a really great team that we're very grateful for. We also have at the country level, our demonstration countries, which are Colombia, Iraq, Nigeria, South Sudan, and Ukraine. And there we have country focal points as well. And we are also, of course, working with regional advisors also. Then we have involvement of the ISC working group, although it's not an ISC product. We are working closely with the ISC co-chairs. We're sharing updates to the ISC mailing list, and we're also connecting to the MHPSS working groups in each of the countries, the technical working groups, which have a really key role. In terms of project support, we are working with academic partners of George Washington University and War Child, who are also on this call, who are supporting us with evaluation and M&E aspects. And lastly, we also have online platform developer System C who are working on the web platform. Next slide, please. So what is the MHPSS MSP? I think many of you already know, but just to say that there are many guidance documents, of course, already on MHPSS, like the ISC guidelines, sphere guidelines, there are guidelines for child protection, for GBV. But what the MSP really does is to consolidate all these guidelines and look at what are really the minimum activities that should be there in any emergencies for MHPSS across different sectors and across different areas of work. So what really needs to be prioritized? And then to look at, for each of the activities, what are the actions that you need to do to achieve this activity, and we'll go into more detail on that. The MSP is also for new emergencies, but also for ongoing and protracted emergencies as well. It describes actions to be carried out by humanitarian actors, and it also includes costs for activities, which can help with budgeting and planning and can also be helpful for donors. Although it focuses on the minimum aspects, the MSP also actually includes points on sustainability and longer term planning for each of the actions, for each of the activities that is outlined. We can go to the next slide, please. Yes, so who is the MHPSS MSP for? So we're really hoping to reach a wide range of actors, of course, program planners who are implementing MHPSS programs on the ground, coordinators, this includes MHPSS technical working groups who play a very crucial role in this, but also other coordination groups or cluster groups like health, protection, education, who want to know more about how does MHPSS fit into the humanitarian response. Donors, of course, are one of our critical audiences. We really hope that the MSP will help make funding decisions that are based on guidelines and evidence, implementing partners, and then also, of course, technical advisors, which many organizations now have technical advisors at HQ or regional level, and we hope the MSP can really help them plan and budget MHPSS activities. Next slide, please. Yes, so what do we hope the MSP will achieve? Well, we hope that the MSP will help different actors coordinate and address gaps in the response. So looking at the MSP and seeing, are all activities being implemented? Are there any that are missing? And then once these gaps are identified, to then advocate for addressing these gaps, to see who can help fill them, to maybe raise additional funding. We also hope that the MSP can help plan and make decisions. So to see which program activities should be prioritized for funding and implementation. And then also, of course, to implement and allocate. So to see, once you look at each action, to see, well, what do I need to do to implement an activity? What actions need to be carried out? And that can help different organizations plan programs more carefully to make sure that all the different elements are included, for example, in terms of supervision, training, community consultations, and things like that. We can go to the next slide. And now I think we will actually have a brief video that describes perspectives from the field. So we will hear from some of our staff in Nigeria and South Sudan about what they hope that the MSP will achieve. Over to Quiva to play the video.
I think the MSP in the context of South Sudan will be more than instrumental. The MSP will generate more evidence. Currently in South Sudan, we are in the process of updating the 4Ws assessment to map the MHPSS needs and resources in the country. The MSP will be a great contribution to this exercise. We will understand more in terms of prioritization of needs. We will contribute more effectively to humanitarian needs overview, humanitarian response plan, or humanitarian appeal funds. And also currently we are in the process of developing the National Mental Health Strategic Plan of South Sudan for the upcoming 5 years. The MSP will help us also to understand more what to do and what is working, what is not working.
We in WHO in the Northeast team are very happy that the minimum service package on mental health and psychosocial support is coming on board. And in our context, in a humanitarian setting, this is something which is long overdue. The minimum service package comes at the right time in this COVID pandemic era, when much is needed, because this will set the tone and will make things clear in terms of advocacy, in terms of coordination, in terms of integrating mental health and psychosocial support, in terms of training the frontline health workers, what specific interventions in terms of mental health services that needs to be done. And these guidelines, we are so proud to be part of it. We look forward to use it. Again, this will give the WHO the opportunity to guide partners. As a minimum service package, we believe that this is what the state can use and ensure that all primary health care services are integrated with this. People with gender-based violence who need support, people with all forms of challenges because of the ongoing insurgency of more than 13 years, and it has brought this humanitarian crisis to the people with a lot of stress and challenges. We believe that the minimum service package is the right time.
Great, thank you, Quiva. And we can go to the next slide. And also just to say, these videos will also be posted online, so you can access them. I think if there was maybe some connection difficulties with the voice, but they will be linked as well. I want to mention the MSP format. As you know, the MSP is available online on MHPSS.net, but it is also available as a PDF. So we want to encourage all of you to register online, which will also allow you to access the PDF. But even if you have the PDF already or somebody emails it to you, we just want to encourage you to register through the website anyway, because that will make it possible for us to know who the MSP users are and also to send you feedback surveys, because we want to hear about your experience in using the MSP online or as a PDF. The coming year is really for us to pilot and test the MSP. So we want to hear from you, and we want to make sure that we can make it even better over the course of the year to make sure we meet the needs of those using it. And now I'm turning it over to Quiva to talk a bit about how the MSP was developed. Thank you.
Thanks, Inka. Great. So I'll just get my slide set up here. Yeah, so this slide gives an overview of the development process over 3 years. And basically the first year of the project focused on the development of the content through lots of literature reviews of key documents in MHPSS, in health, in education and protection, particularly child protection and gender-based violence, as well as broad humanitarian guidance like the Sphere standards. And this was followed by lots of consultations through global networks for MHPSS and the relevant clusters and areas of responsibility. So we had more than 100 participants in interviews and focus groups in diverse locations and roles around the world. So we really focused on getting input from implementing colleagues that are actually based and working in emergency settings, as well as global and regional advisors. And then the draft was based on these lit reviews and the consultations. And once it was drafted, it went through multiple rounds of peer review, again with colleagues from diverse sectors, roles, and locations. And now we're in the field demonstration or pilot phase. And this will involve inviting colleagues globally to read and use the MSP and provide feedback. And I'll explain how you can be involved a little bit later. As well as working more intensively with colleagues in the 5 countries that Inka mentioned earlier to implement components of the MSP and learn from rolling it out in practice. So as Inka mentioned, the 5 countries involved in the implementation pilot are Colombia, Iraq, Nigeria, South Sudan, and Ukraine. And the purpose of this practical pilot is to further develop the content and the tools. So for example, to further develop a monitoring evaluation framework, to further test and develop the costing tool. Also to evaluate what we've got so far in terms of its acceptability, feasibility, use, and impact. And to support partners to initiate, strengthen, or scale up MSP activities and learn what we can from this process to improve the final product. So after this field demonstration phase, we take on the feedback from these different sources to revise the MSP before its final launch towards the end of next year. So what does it actually look like? Well, the main package consists of 22 activities. Different types of activities are organized into different sections, which I'll explain in a moment. And each activity is tagged, so it's easy to see which sectors are most relevant to the activity. So you can see the little colored circles there in the image. And each activity also comes with additional materials and steps to support planning, and I'll show you what that looks like a little bit later. But as well as the activity-specific content, the MSP comes with a costing tool to help estimate the overall cost of the whole MHPSS response, and a gap analysis tool. And the gap analysis tool is designed to help coordinators and implementers identify gaps in the minimum activities within a particular defined geographical region. So it could be a particular camp or town. So they can then work with partners and donors to advocate to fill those gaps. So Inka will go into more detail on those a little bit later, but I'm just going to give you a quick tour of the activities. So the 22 activities are organized into 4 sections, each focusing on a slightly different type of activity. So from interagency activities to activities that are more about setting up a strong, well-managed MHPSS program, and then of course the actual programmatic activities. So this slide gives a sort of a zoomed in view of the activities. It's a little heavy, so don't worry about reading it all. You can take your time to explore the activities at your own pace. But I'll just walk through the sections quickly to give you a sense of what's in there. So section 1 focuses on interagency coordination and assessment for the MHPSS response. So these activities are particularly relevant to technical working groups and coordination groups as they rely on interagency work. And then section 2 lists essential components of all MHPSS programs. So these are activities that any organization engaging in any type of MHPSS activity should be doing. So things like thoughtful program design, developing systems for monitoring and evaluation, and systems for staff well-being, and supporting and monitoring staff competency. Section 3 is on the right-hand side of the slide there, and that contains all the programmatic activities. This is the main body of the MSP, and it covers activities from community-wide messaging, supporting community self-help, right the way up to focused support like psychological interventions and care and protection for people in psychiatric hospitals and other institutions. And then finally, section 4, which is on the bottom left. It's a little difficult to fit this all into the slide, but on the bottom left, you see section 4, which contains activities focused on specific settings. So things like infectious disease outbreaks and MHPSS for people deprived of their liberty. So each of those 22 activities, it comes with a brief introduction explaining why the activity is important. So that's just a couple of paragraphs, a checklist of implementation actions to deliver the activity safely and effectively, additional actions for consideration that can be prioritized depending on the context-specific needs and available resources. Each activity also comes with a list of key guidelines, standards, and tools to support planning and implementation. And finally, a list of budget items for consideration. So this is to help program planners estimate the human and material resources that are needed to implement the activity. And that then links back to the costing tool, which considers the same budget items. So this might seem like quite a lot to take in. So I'm going to show you another brief video which shows you what this looks like on the web platform.
The MSP platform is available at MHPSS.MSP.org. You can use the buttons on the top right corner of the page to log in or sign up to access the platform. You can also toggle between different languages. Once you log in, you'll see that the platform has 3 main sections: the Home tab, the MSP Guide tab, and the All Activities tab. The Home tab provides a brief overview of the package. The MSP Guide provides a more detailed introduction, explaining what the MSP is, why it's needed, how it can be used, and how it was developed. The guide also includes a section on general principles and considerations that are critical to the safe and effective implementation of the MSP. From the guide menu, you can also download a shorter PDF version of the MSP. The All Activities tab lists the 22 MSP activities. From here, you can click on any activity to access a brief introduction to the activity, a checklist of core actions, additional actions for consideration, and a list of relevant guidelines, standards, and tools. Some activities contain additional information, such as key considerations specific to the activity, and lists of recommended training topics for staff implementing the activity. The MSP platform will continue to be updated with translations and user improvements during the piloting phase. All registered users will receive a survey to provide feedback, which will help us to make the platform as useful as possible.
Okay, I've been getting some messages there. I'm not sure if the video is actually streaming very well for everybody, but just to let you know, we'll definitely put these up on the platform so that they're available. I know it uses quite a lot of bandwidth, so it may not have come through so well for you. But also just so that you're aware of what it looks like in the PDF version, this is an example of the activity in paper form or PDF form. And the PDF includes all of the core content, like the general principles, the key considerations, and the activity checklist. But to keep it to a manageable, printable size, we haven't included the long lists of supporting guidelines and tools, but there are hyperlinks throughout, so you can easily click on any link throughout the PDF and it will take you to the corresponding section of the platform. We know some people generally prefer a PDF format and other people prefer an interactive online format. So we felt it was important to have both, but like Inka said, we do encourage you to register online because we don't want to miss your input basically. So everyone who registers online will receive a feedback survey in about 1 month's time. Okay. So we thought we'll have a longer question time at the end, but we thought we might have a quick pause here to see if there are any burning questions before we talk about the additional tools that come with the MSP in a bit more detail. I think Alison has been monitoring the chat.
We don't have any questions in at the moment in the chat box, but feel free to speak up, to raise your hand and ask your questions.
Yeah, Quiva, maybe we should continue till the end and then we can check in again. But we encourage everyone to put any questions in the chat, and then we'll call on you to ask the question.
Great. So I'll hand back over to you, Inka, then to talk about the additional tools.
Okay. And I see one question, by the way, but I'll go ahead anyway, and then we'll start with that one after I get through this. So I just want to mention now the additional tools that Quiva already mentioned. We can go to the next slide. One is the MSP gap analysis tool, which is available online. And this provides information about what the gaps are in terms of the MSP activities. So you have seen that Quiva showed this long list of activities, and this tool basically helps you to see in a specific geographical area where are gaps in these activities. And in the countries that have been selected for the MSP demonstration, we're also conducting surveys actually to see which MSP activities are being implemented. Next slide. Yeah, so this is just an example of a gap analysis summary. I entered there Switzerland, Geneva, just as a demonstration, but there you can see for each activity, it shows whether it's implemented, not implemented, or partially implemented. And then you also see a summary at the top. So this can also help, for example, communicating gaps at meetings or to donors, for example, or to keep track as well over time to see to what extent MSP gaps are being filled. Next slide, please. Now I also want to mention the costing tool, which basically helps to cost each of the MSP activities. So in the costing tool, you can check to include or not include any of the activities listed. And then it will give you an estimate on how much each of the activities cost and also how much all the activities cost together. Of course, you have to enter some basic information. For example, the country, the size of the affected population, number of health facilities, things like that, that help us calculate the costs. But we think it is pretty easy to use and relies on some default values that can also be changed. For example, if you say, no, this doesn't need an international staff, we can use national staff for this, you can actually change it in the tool to come up with more accurate costing. And we can go to the next slide. And there you see just an example. On the right-hand side, you see how the costing tool actually looks in Excel. So there's an example of MHPSS coordination. And there you see there's a technical working group chair budgeted there on the first line. So this basically looks like a budget with all the different personnel, all the different items, and also how much it costs. On the left side, you see our budget tables. So these tables are also available for download in Word format, and they just tell you about the budget items which are included in the costing tool. So if you're, for example, planning an MSP activity and you're working on a budget, you could also look at these budget tables to kind of help you plan for which staff to include, what maybe to consider in terms of equipment you might need, translations you might need, materials and things like that. So we hope this can help program planners, but could potentially also help donors as well when they're releasing calls for proposals about how much it might cost to implement specific activities. And now I think we can go to the next slide, which should be questions. So now we wanted to make sure we leave plenty of time for questions, and we did not want to run out of time. I see we have like 100 people now, which is great, but maybe too many to just go by hand raising. So I think we'll just maybe look through the chat for questions. And I think Allison, you will take over from here. Thank you.
Sure. So the first question we had, is the expectation that if one is implementing an MHPSS intervention in any one of these areas, all these activities need to be implemented? So this may have been addressed by Inka when she was speaking about implementation, but maybe you want to just clarify, Inka?
Yeah, Quiva, maybe we can go back to the slide that shows the activities and action as an example. And I know we just went maybe the one with the book page. Yeah, so I think this was quite a lot to take on, and sorry, maybe this is a little bit small, but basically every MSP activity, for example, here we have protect and care for people in psychiatric hospitals or institutions, comes with a checklist of actions. So the actions are all the things that you would need to do if you're implementing this activity. So for the psychiatric hospitals, for example, it includes things like monitoring visits, making sure that basic needs are met, like for clothing, food, and things like that, doing some orientations for the staff, making sure psychotropic medications are there. So these are the core actions that are listed there. So the answer would be yes. If you're implementing the MSP activity, we would think that all of the core actions would be relevant to that activity. Then you also see further down additional actions, which you may or may not need, depending on the context and also depending on resources. So these include some things that are relevant for also sustainability and longer term planning. And I hope this answers the question, but if not, please feel free to type into the chat box. And back over to Allison.
Okay, the next question we have is, does the gap analysis align with the 4 Ws or similar, i.e. is it aligned with what IASC might do? The collaboration on a common analysis is an example of helpful coordination. So I don't know if Quiva or Inka, one of you want to address the gap analysis and how it lines up with 4Ws.
Yes, I can quickly say something about that. MSP does not perfectly line up with the 4Ws, because the MSP is really about the minimum essential core actions. So that means it does not include everything. So that's one point. The other point is that we actually have, as part of the gap analysis, a table that shows the 4Ws codes and that shows the MSP activities. So if you, for example, already did a 4Ws analysis, you could look at this table and actually see how it applies to the MSP. And also to add that the issue with the 4Ws as well is that it kind of mixes different areas of the MSP as well. For example, we have coordination and assessment as two items, and then we have also a section with items that actually are relevant to each and every organization. For example, M&E, which is something that can't really be mapped as part of the response. It's something that each organization needs to do. So it's organized a little bit differently, but we hope that this 4Ws table that we have will help you kind of see where differences and similarities are over. I don't know if Quiva, you want to add anything, or if we should go to the next.
No, I think they're great questions. I might just add to the first question. Just we want to make really clear that obviously no one agency is expected to implement all of these activities. So the idea is that across the whole response, all agencies are collaborating to make sure that these minimum activities are covered. I'm not sure if that might have been actually what someone was getting at in the chat there. So basically between whatever agency, implementing agency you're working with, in collaboration with all the other agencies in the geographical region, that between all the agencies, the MSP would be covered. But there's no expectation that one agency would do all of them. And there was a related question, I think, from Alison Schaefer related to the gap analysis, which is asking whether the function is available at both a coordination level and at an organizational level. And I think the answer to that is yes, in that the tool is going to be available online for anyone to use. So you determine which geographical region you're looking at and what your parameters are. But it just helps you by kind of mapping out very clearly what the activities are, and you can say whether it's fully implemented, partially implemented, whether there's full geographical coverage or not full geographical coverage, and then shows you the summary that Inka showed us the example of.
Okay.
Great. Thank you. Back over to Alison to make it through. Now I see we're getting a lot of questions, which is great. So Alison, which one should we do next?
Okay, I'm trying to group them together thematically. So if you don't hear your question yet, it may group it with a similar question. So there's a couple of questions on the costing tool. When will the costing tool and gap analysis become available? So that's the first one around the costing tool and gap analysis.
Yes, I can quickly say that actually the gap analysis is being piloted right now with some selected users. So it's there, but we're still taking on board some feedback. So it should be there, I think, within the next week or two. And I think the same is for the costing tool. We're just making some final tweaks, and it should be online probably within the next week. And just to note that both of these tools are drafts. So if you look at this and you think, oh, this is not feasible, I don't know what this is, I need to do this to make it useful, please let us know, because now we have the chance to make it make it useful for you. So just to say, please give us feedback. These are both draft tools. Thank you.
And here's another one on costing. Many countries and even some regional responses have tried to tackle activity-based costing tools. I have not seen something like the costing tool you have shown. How are costs contextualized from country to country and region to region? Also, salaries vary from agency to agency and even from international NGO to international NGO. So wondering how a global standard tool works from context to context.
Yes, great question. So the costing tool now has a drop down for countries, and the countries included in the costing tool now are the 5 demonstration countries for the MSP. But in the coming months, we will broaden it to actually include more countries. So that answers part of the question, is that the costs are actually based on these specific countries and what, for example, salaries are for national staff, for equipment, for office rent, and things like that. So I think that's where the context comes in. But I would also add that we have also reviewed budgets as well for MHPSS from different INGOs to make sure that we're also in the ballpark for these different countries, and to add further that this will also be part of our evaluation of the costing tool will be to see how well do these costs match, and is there a way to make them more accurate over.
Okay, the next one. Is there room for adaptation in relation to some of the tools that can be used for the activities? Could we marry this with the capacity building in MHGAP, for example?
Yeah, shall I jump in on that one? So absolutely, the MSP is quite high level. So you'll see that it describes activities, but it doesn't specify which curriculum you should use to train your staff, or which program materials you should use for structured activities with children, for example. What we do have in there, just to make it quick and easy for people to get started, is we do have a list of publicly available curricula and programs that are available, including the MHGAP. So the MHGAP is a really core program, and it's core to the activities in the MSP. So we don't specify, for example, which type of psychological intervention it should be done, or which structured program for children. It's up to the agencies to find what's appropriate in their context in terms of specific training curricula and tools, etc. But we do obviously list the main ones that are available. So the MHGAP is absolutely core, and that is the one that we would expect most people to use when you're looking at integrating mental health into primary healthcare. So definitely we don't expect that there will be anything inconsistent in the MSP with the commonly used tools. They're designed to work together with those other tools that are developed and recommended by WHO, for example, and also UNICEF and the other agencies involved.
Yeah, Akiva, maybe you can go 2 slides back to just show again, because this is a bit hard to see. One forward again. Yes, so there where you see at the bottom guidelines, standards, and tools. So this is where you would find all the guidelines or even examples to implement each activity. So for clinical, mental health, and general healthcare, for example, you would find the MHGAP right there under this guidelines, standards, and tools tab. And maybe one more thing to mention as well is if for the activities, we're also getting feedback as well about what, if there are gaps also in terms of guidelines or where more information is needed. So again, we're looking for your feedback as well in terms of if there's anything else that you feel like you need to implement a specific activity over.
And this has maybe been answered by what you've just described, Quiva and Inka, but the next question is there room for adaptation in relation to some of the tools that can be used for the activities? That we already did. Are there corresponding M&E tools that are recommended for use for the core activities? Perhaps mandatory for uniformity in collecting data?
Yeah, so we're working on an M&E framework, which we're planning to roll out, to test in the field demonstration phase. We're working closely with George Washington University and Voorchild Holland as our academic partners who are also on the call. So feel free to jump in if you wish. But absolutely, it's important that this is aligned with the IASC Common Monitoring Evaluation Framework, which is also out there. So like I said earlier, the MSP is very much designed to be sort of an overarching framework that works with and complements the other existing tools that are out there. So it's what we would encourage is that the IASC, and we will provide guidance on this, but how you can basically use the IASC Common M&E Framework with the MSP. And there is an actual activity, it's very small, but you'll see in section 2 here, we have essential components of all MHPSS programs. Design and implement an M&E system is one of them. And within there, you have your checklist of actions like you have for every other activity about how you go about doing that, because I know monitoring and evaluation can be an area of quite a lot of anxiety for both our MEAL colleagues and for programmatic colleagues implementing MHPSS. And it doesn't have to be. There's quite a lot of ways you can monitor impact. And together with the Common Monitoring Evaluation Framework, we hope the MSP will actually provide a lot of reassurance and help for people to provide clear steps on how you can do solid M&E within MHPSS.
There is a next question. Are there age, gender, and disability considerations as well?
Yeah, I don't know, Alison, if you want to take this one on.
Sure. Yes, there are. So how it's structured, we tried not to go into specific groups with specific activities. So one of the areas that you can see, we have one at the beginning, we talk about general principles and considerations, and age, gender, and disability are sort of contained there and described there. However, it is something we tried to include throughout the whole MSP. And also throughout, you'll see something called key considerations. So in those, we have maybe some more specific information about specific groups, age and gender and disability. So those kind of provide general thoughts and guidance, as well as some specific issues like survivors of sexual violence and considerations for different groups. So that is where you would find kind of the more specific information, but we definitely try to ensure that age and gender and disability were considered throughout.
Yeah, and maybe to mention, Alison, also that you had consultations on this as well.
Yeah.
Yes.
Definitely. We worked closely with various groups on disability and had multiple consultations around gender and also around gender-based violence specifically. So hopefully, but again, as Inka has been saying, if you feel like there are gaps, we definitely will consider those in the future.
Yes.
There's another question, sorry, now I'm gonna catch up with the chat, but there was another question that is, 1, do you plan to organize trainings on implementation of the MSP? And 2, what steps, such as some algorithms, should be done by an organization to implement the MSP?
Yes, I can say something about the trainings, or maybe I should say orientation on the MSP. Yes, so this is one of the orientations now, although it's very brief, but we're also planning more in detail orientation, for example, for MHPSS rosters, for MHPSS technical working groups. We have offered donors to also do orientations for them as well. So also, if any of you have groups that would be interested in an orientation or more discussion around the MSP, or even if you just want to talk with us more about the MSP and how you would use it, we're completely happy to do that. So yeah, we're scheduling various orientations now with many different groups and individuals, and happy to have more. Oh, and yes, so this is the first question. Algorithm, what steps should be done by organizations to implement the MSP? I'm not sure, Quiva, do you know what it means, algorithm?
I'm not sure. I mean, you're welcome to maybe turn on your mic and ask that question so we can understand it more fully. But maybe if you're asking about specific steps to implement the MSP, It's available online right now, the field test version. So for any activities that you are thinking of doing, or any activities you're already doing that you think could potentially be strengthened by bringing in the MSP, you can just go to that activity on the platform, look at the, or in the PDF, look at the checklist and go through, and you might find, oh, I'm already implementing, 50% of these actions, but there are another 50% I'm not doing. Or maybe you're doing some programmatic activities that you haven't really considered, this section 2 activities about M&E, about caring for staff and volunteers, about supporting and monitoring staff competency. So basically it's there available for your use. It should be pretty self-explanatory in terms of their checklist that you can follow, but it is still very much in a field test and pilot stage. So if there are things that you find are blocking you from moving forward, or things that are not clear, that's exactly what this phase is for. And we'd love for you to reach out and tell us how we can make it more user-friendly, or anything that's not clear, how we can improve it.
Yeah, that's a great point. And maybe just to add to that of course we don't expect every single organization to implement every single MSP activity. And even there you see different colors for different sectors that may be best placed to implement certain activities. For example, supporting education personnel to support the psychosocial well-being of children, number 3.8. Education sector is very well placed. So it might be worth to just think within your own organization, well, what are we already doing? And where is our technical expertise and capacity? And where do we want to place ourselves? And where are we strong? And maybe to look at, if there are maybe some gaps in things that you're already doing, maybe some actions could be taken to strengthen existing activities. So I think these are many ways in which you can use the MSP to strengthen what you have, or to initiate maybe new activities or areas of work.
Going back, there was another question on costing that I missed. So if we can jump back to costing. It says, since the MHPSS would often be joint, there would be joint interventions between sectors such as health, education, and protection. How does the costing tool account for joint responses and identify costs per sector?
Yes, that's a good question. So at the moment, the costing tool does not distinguish actually which sector would implement the activity, although that could be a consideration, would be, for example, to check, this sector is doing this activity or that. But as you see also on the slide, many of the activities could be done by any sector almost. So it is not actually organized by sector, but rather by activity, for example. So say if you have a population of 100,000, how much might it cost to do activity 3.2, orient frontline workers and community leaders? So how much it might cost, regardless of whether it's implemented by a health actor or education or protection actor. Over.
Yeah, and I might just add that for certain activities, so for example, if we look at 3.13, it's provide MHPSS through protection case management services. The costing tool is only considering the additional MHPSS costs. So it's not going to calculate the entire cost of all case management services. It will account for things like MHPSS trainings, provision of specific MHPSS within case management. So we needed to be very careful about that, so that we didn't basically duplicate costs that are already covered in through other funding streams, etc. So it's been quite a lot of thought has had to go into figuring out how we isolate the MHPSS costs from some of the broader costs in other in other broader services that incorporate these activities.
Okay, we have another question. Is psychological first aid included in one or more of the activities?
Yes, that one is easy. You can go to, on the slide, you see activity 3.2, orient frontline workers and community leaders in basic psychosocial support skills. And we use the phrase basic psychosocial support skills which also refers to psychological first aid because it's a broader term that's being used more now. For example, you may have seen just the guidance that came out on COVID and basic psychosocial support skills for those responding to COVID. So that is the term that we use. But once you click into that activity, you will actually see PFA resources and descriptions in there. And maybe also to add that this is a term also to include other basic psychological support, for example, in the GBV area, where we have something called lives that is also like PFA, but includes protection components. So this is why we included this broader umbrella term over.
And maybe a somewhat related question is, are the activities based on the 4 MHPSS intervention pyramid?
Yeah, this is another very good question, which we've had many discussions about this throughout the development. So actually at the beginning, that was kind of the format we initially went with in terms of structuring the MSP after we had done big literature reviews and gathered all of the activities that we could find basically mentioned in any of the guidance that exists. And we arranged them and rearranged them in many different ways, starting with the pyramid, but also we arranged them according to the socio-ecological model and various other models that we tried out and field tested. Basically, we did user testing in collaboration with human-centered design consultancy who helped us. And actually, we were a little bit surprised ourselves that actually the pyramid was not the preferred way of organizing these activities in the end, partly because there can be quite a lot of confusion about where certain activities sit in terms of whether they're level 3 or level 2. And also we were trying to incorporate, well, there were also some feelings that different sectors, some sectors refer to the pyramid an awful lot, but other sectors are less likely to use the pyramid in their sort of day-to-day conversations and more likely to use something like the socio-ecological model, particularly child-focused services. So it's absolutely compatible with the pyramid, and actually Inca has been working on developing a model that maps this onto the pyramid, so you will be able to see how it relates very clearly. And it is coherent with the pyramid, but just for usability and because of the various consultations we had, this was the structure we landed on in terms of how we structured in the MSP. But that's not to say that it isn't relevant to the pyramid. It absolutely is. I don't know, Inka, if you want to add any more.
Yeah, maybe to just add one more point. Yeah, when I structure it according to the pyramid, it's really section 3 of the program activities, which are already organized similar to the pyramid. For example, provides focused support for people impaired by distress and mental condition. That is also a layer of the pyramid. And then we have support to communities and basic psychosocial support skills. So we have that there, but there are things that are missing from the pyramid, like coordination, for example, which is so important, you know, sheet number 1 in the MHPSS IEC guidance, but it's not in the pyramid. So we had to organize it a bit differently to say there we have coordination and assessment, which is relevant to the humanitarian response. And similar to section 2, you can't really map M&E on the pyramid, but yet it is important for each organization. So we needed that section as well to kind of draw out these important aspects of M&E, of staff care, of competencies, and that were also missing. So I would say it's like the pyramid plus additional aspects that are compatible, but also organized in such a way that we can ensure that it is a comprehensive list over.
And actually, it's kind of an interesting point that actually, I think at the beginning when we set out to start working on this, we were expecting to be almost entirely focused on programmatic activities, but it came through really, really strongly in the consultations that what people felt was, we have an idea of what the core services are. Where we're really falling down is more on things like M&E and staff well-being and how to set up your program so that it's really robust. And so that's why these section 2 activities ended up playing a much more central role, I think, than even we had anticipated at the beginning, because really it's what people asked for in addition to the programmatic activities. They wanted more structure around these other elements.
Yeah, and now I realize also we have 3 minutes left. So maybe just one more question. Alison, I don't know if you have one in mind. I see one here from Isubalo about field testing.
Yeah,
Maybe.
there's one about field testing, and there's one more about the WHO Special Initiative for Mental Health. Maybe we can start with the field testing, and then the one final question is, if people want to stick around, I'm not sure, we could maybe tackle the last one if we have a minute more. But yeah, the first question, how does the field testing work in practice? Who will be the primary partners at country level and the specific selected agencies, technical working group, local authorities? What do you expect to learn from the field testing in general?
Yeah, I can try to do this in 1 minute. Field testing, yes, we have the 5 demonstration countries, and what's unique about them is that they receive funding for MSP projects, although it's very little funding. And we're working there with the WHO and UNICEF focal points and monitoring what is happening there very closely and getting feedback. But we don't want to limit ourselves to these 5 countries. So these are, we call them demonstration sites, but we actually want everybody to be involved. We just received a message from Yemen Health Cluster last week, and they were interested in having a presentation on the MSP. So we're planning that. So this year is wide open. We want to engage with everyone on this, and maybe I should mention also with the special initiative as well. Ukraine is part of the MSP demonstration countries, but also part of the special initiative. So they're already making links to the MSP at the country level, and we encourage all countries that are part of the WHO special initiative to make links as well to the MSP if there are humanitarian regions that are affected, and we can have conversations about that. And maybe then lastly, I think there was a question here about involvement of groups and risk groups for people with disabilities. So I would say again, yes, we've had these initial consultations with groups working on disabilities, but we're happy to hear more, even if some of you want to organize specific meetings or presentations on the MSP where we present and we hear from groups that you're connected with, including people with disabilities, service users. We're wide open for that. Of course, we are reaching out. We have a list of stakeholders that we have mapped that we're reaching out. We have people reviewing the MSP, but we're not limiting ourselves. So if you have more ideas, please let us know. And now we're at time. So just check in with Alison. Do you think we responded to everything, or is there anything quickly we should say?
I think we have covered all the questions in the chat.
I know many of you, probably all of you, are incredibly busy, especially now, and may have more meetings you have to run to. So I just want to thank you for being here. Thank you for your time and interest. We hope to hear from you. We hope to engage with you over the next year. Yeah, Quiva, anything you want to add?
No, just it's great. Thank you for all the nice words in the comments as well. So we have been working on this for a while, so it's great to see that you will find it useful, and we look forward to also constructive feedback that makes it really fit with your needs as well as we can. We'll share the videos because I know they didn't play too well, and we'll share the slides, and we will make everything available through the platform. Thanks, everyone.
Exactly. Yes. Thanks, everyone. Take care. Bye.